Over 1,100 people have died from COVID-19 in the province, and that now includes a frontline worker, Joe Marie Corral. The 61-year-old dad, who went by the name Jing, was a healthcare aide at Bethany Riverview in Calgary, where there is presently an outbreak affecting 20 staff and 20 residents, and also where 2 people have died. The Alberta Union of Provincial Employees said the man contracted the virus while at work. Alberta Health Minister Tyler Shandro offering his condolences to his family, friends, loved ones, and colleagues. The man's death is one of 96 reported over the past 5 days. The provincial death toll now sits at 1,142. The province identifying more than 5,000 new cases over the same number of days. That's from about 66,000 tests. The positivity rate at about 7.7%. However, active cases still trending down, with about 700 fewer active cases than before the new year. Just over 900 people are in hospital, with 136 in the ICU. Meanwhile, Alberta Health Services has stepped up the pace of vaccinations. Alberta now vaccinating about 3,000 people per day, an increase from about 500 in the first weeks. As of yesterday, close to 23,000 vaccines have been administered. A Calgary emergency room physician who is watching the numbers closely is worried about whether or not Albertans will hunker down and do the right thing in the face of the recent UCP travel scandal.
I like to think a lot about how policy impacts Albertans and how policy impacts COVID transmission. And my biggest concern about these revelations is that it kind of disintegrates the social compact a little bit that citizens have with our leaders. We obey the rules because it's expected and it's fair and we're all in this together. I'm worried that when it comes to either extending the current restrictions or applying new restrictions, that the actions of our leaders may reflect to a point where citizens are not willing to engage in that social contract.